Hello everyone, this is Dr. Dylan. Today we're going to answer the question, will braces affect the shape of my face? This is a difficult question, loaded question, because there's so many elements to this question that can possibly create an impact or not create an impact. So first of all, let's separate people who are growing versus not growing. So children versus adults. In theory, there are certain things that can be done if the jaws are growing incorrectly, certain appliances and stuff that can help to maybe get growth back on track and hopefully in a more positive way. And that certainly can have a role. But then also there's lots of studies that show that certain things like mouth breathing can have a negative impact on our face. It can have a negative impact even on how our cheekbones develop and how the length of our face can change. So let's say you could be in braces during a period of time, in a child, for instance, but that child continues to mouth breathe during that whole time and unfortunately hasn't been working on their mouth breathing habit. Their face can grow unfortunately in some ways, a somewhat negative way, although their teeth might be getting straighter due to the braces. It's one of those things where, like I said, braces themselves move teeth and they affect just the bone around the teeth primarily, which is the dentoalveolar bone, but they don't necessarily have a direct impact to things like your cheekbones, the angle of your jaw, your chin, things like that. Those are affected by other factors like, if you gain or lose weight, or if you change your diet so that it's either becomes a very soft diet. Perhaps, let's say, maybe a patient who wasn't in braces for a long period of time and started eating very soft foods, that would affect their muscle structure around their face. And that could affect how their face looks. So like, for instance, if you were in braces just for a few months, it's highly unlikely to change your face. But if you were in braces for a long period of time and it affected other factors, like if you started chewing on one side only. I've had patients where unfortunately they had a habit of chewing only on one side and definitely affected how their jaw structure grew on one side versus another, created a facial asymmetry. So ultimately, in terms of things that can be done to prevent unwanted facial changes, so things like, you want to work on mouth breathing, you want to make sure you nip it in the bud, you want to make sure your tongue's resting against the roof of your mouth, you want to make sure you're swallowing in such a way that your lips are not pushing inwards or your tongue is not thrusting forward, it should be pushing up and not forward. And you want to eat a healthy diet where you eat some harder foods and not eat such a soft diet. Like, unfortunately, a lot of our meals are nowadays. So eat some crunchy stuff every day. Work those muscles. It helps develop our jaw structure. It helps develop, a more balanced face.